in July for Bong County, when 5 nurses working at a Phoebe hospital came in contact with Ebola patient that came from Monrovia, and those nurses, 4 died, only 1 survived. The entire Bong County came to a standstill. And as a result of that, because they were the first people targeted, not ordinary people, but nurses, so that fear was wearing the entire county. From July the 18th, the county started what we call the Ebola Task Force regular meeting. And that meeting, it was intended to provide updates about the Ebola situation in the county at that time. And as a community radio station working with community people, we were selected to be part of that task force. So we created a special radio program called Ebola Situation Report. Ebola Situation Report was there every morning on Radio Gbarnga from 6:15 to 6:45, giving daily update about Ebola situation from the task force, because the task force were meeting every day, Monday to Saturday, at the Bong County Health Team office. So, result for those meetings, updates coming from the field, we were able to produce them into a radio piece, and were able to inform the citizens across the county about the happening. Between July to October, we were able to produce about 80 editions of Ebola Situation Report. Then from October, we start having a decline. That is, the situation was a bit improving now, especially with the opening of the ETU. So the frequency of the meeting reduced. So that's how, instead of daily, we're doing it 3 times in a week until we reduce, so 1 time a week up to December. That's the time we're able to wrap up. And beyond that, we created the space for civil society actors, health workers, all those that were involved in the Ebola process, to have a space on the radio. Every 1 hour we'll bring something. Even our major news and current affairs programs, like the lunchtime news, News Watch, the info bus, we integrated Ebola messages in all the programs, so that whenever you're listening to something from the radio station, something pertaining to Ebola should be there. We were able to broadcast to over 729 persons on a daily basis. How did we derive this figure? We have a partner in Canada called Farm Radio International. They developed a technology for us that are able to ensure that we know our audience coverage. That is the audience map for Radio Gbarnga. So we're able to supply that information about the station, especially the wattage of the transmitter, the height of the tower, the bit, and what have you. So from there, they were able to manipulate that information, and they came up with an audience map for the radio station that clearly tell you where are those areas, those counties, those districts that the station cover. So on a daily basis, we provided information. We provided relevant information to residents of Bong County about Ebola to increase their knowledge of simple preventive measures. We increased public education about the various preventive measures available. We help sensitize community residents to develop the cultural acceptance for Ebola survivors and discourage the act of stigmatization against Ebola survivors. All these things were done in the local languages and English.